think in the future, in about 10 years from now, we're talking about personalized medicine. You're going to see a lot more of these clinician portals that are for patients, where they can actually have a code when they go apply to a clinical trial, and they can get their information even though it may be a blinded study.
You know, the more data that people have access to, you know, in theory, this is a wonderful thing, right? That, you know, technology is bringing this all. We can all have more numbers about ourselves, and this is meaningful stuff. But, you know, we as an industry need to find ways to communicate that effectively.
Have you ever gone to some of those forums?
Oh, yeah.
And there's lots of misinformation.
Especially the oncology forums, right?
Yeah, and some, you know, and it's because everybody gets a voice, and that's good. Everybody should have a voice, but some of it is scientifically incorrect, and so what can be trusted? That's the big social media question right now in the world. What social media can be trusted?
I think you bring up a really good point there with the media there, in the fact that the media is there to make money. So the more data we share, the more opportunity they have to take whichever statistical part of that data they choose to get a headline. And we all know headlines can be absolutely terrible. You know, we found a cure for this. Well, we haven't. We have some data that may suggest it works in an animal. You know, we aren't even close.
Yeah.
So how much do we share?
The world is changing. You know, even your personal information there, the people can't get it. But how we can prevent negative usage, utilize this way more useful data for good things.
Yeah, I think earlier it was mentioned, you know, about wanting to make sure that you share the whole picture and the full data set, because that in its entirety is what we are able to draw conclusions on and take the right interpretation from.